Hi, this is Sangeeta. I'm a physiotherapist. Do you know not just the alcohol, even sugars can damage our liver badly? Yes, in this video, we are going to discuss about non-alcoholic fatty liver disease that is not associated with alcohol consumption but the food we eat. There are two types of fatty liver. One is alcoholic fatty liver caused due to alcohol consumption, and another one is non-alcoholic fatty liver that is not linked to alcohol consumption and referred as NAFLD in short. NAFLD is increasingly common nowadays, and recent studies show that 30% of world population or 1 in 3 people have non-alcoholic fatty liver. Being so common doesn't mean that it's harmless. It is considered as a silent killer as no signs and symptoms are noticeable until the damage becomes severe. In the later stage, patients report to hospital having vomited blood. At this stage, liver damage is almost irreversible. Approximately 20 to 25% of people with NAFLD develop inflammation of liver known as non-alcoholic steatohepatitis, shortly NASH, which may cause destruction of liver tissue and severe damage may lead to scarring of liver tissue known as liver cirrhosis. Liver cirrhosis eventually leads to liver cancer or liver failure. Initially, people don't notice any signs and symptoms of NAFLD, but when NASH develops, they start noticing symptoms like weakness, pain in right abdomen, itchy skin, jaundice, loss of appetite, and nausea. Nausea means sensation of vomiting. In advanced stage of liver cirrhosis, abdominal distension, that is, swollen abdomen due to fluid retention, confusion, tremor, coma, and even hepatic encephalopathy may occur. This means in later stage, cirrhosis may even affect our brain and leads to life-threatening complication if left untreated. The good news is fatty liver and even NASH is reversible, but liver cirrhosis is not. Now let's discuss the causes of NAFLD. Even though genetics play a role in predisposing NAFLD, alarming increased prevalence of fatty liver indicates that unhealthy diet and lifestyle causes fatty liver. In fact, doctors are now suggesting to change the name of NAFLD to MAFLD, that is metabolic dysfunction associated fatty liver. So now, what is the criteria for metabolic dysfunction? Having 3 or more of the following triad is defined as metabolic syndrome. And if a person has 3 or more of these triads, he is advised to take liver function test. Number 1, high waist circumference 35 inches or more in women and 40 inches or more in men. Number 2, high triglycerides 150 mg per deciliter or more. Number 3, reduced high density lipoprotein HDL less than 40 mg per deciliter in men and less than 50 mg per deciliter in women. Number 4, increased blood pressure more than 130 by 85 mmHg. Number 5, high fasting blood sugar more than 100 mg per deciliter. Unfortunately, there are no medications available for NAFLD. But here is an interesting fact. Our liver is the only organ that can regenerate itself. If we just stop abusing it, it will recover by itself. Even if you are an occasional smoker or drinker, please quit smoking and drinking. Try to lose weight. Losing just 3 to 5% of body weight can considerably reduce fat in liver. Say no to processed foods. It's not just the fat you eat. All extra calories you eat, no matter where it comes from, gets converted as fat and stored in the liver. Sugar causes the same damage as alcohol does, especially the sugars from packed foods. Not all sugars are equal. The sugars we use in our home is a mixture of glucose and fructose. Fructose is sweeter than glucose. While glucose can be metabolized by all cells of our body, fructose can only be metabolized by liver. Unfortunately, added sugars that you eat from packed foods are mostly fructose. So remember, whenever you open a packet to eat, you are actually damaging your liver. Start exercising. Exercising at least 30 minutes per day or 150 minutes per week can improve metabolic health and also reduce fat in liver. Happy news for coffee lovers. Studies suggest that consumption of coffee can reduce the risk of developing fibrosis or cirrhosis. Healthy diet is the key to reverse fatty liver. Switch to complex carbs and avoid simple carbs. Pulses and whole grains are rich in complex carbs. Eat plenty of vegetables, especially green leafy vegetables. Fruits contains fructose, but they are rich in fiber and antioxidants, and hence consume them in moderation. Say no to fruit juices and take whole fruits. Choose fish over red meat. Include seeds and nuts in your diet for healthy fats. Prevention is always better than cure. Please check our website for more informative contents. Likes, comments, and shares will motivate us to make more informative videos. Thank you for watching. Good day.